Happy New Year, everyone. It's your girl, Nurse Mimunat. Welcome back to my channel. We are officially in 2026. And while we are chasing those resolutions, don't forget the most important thing, your annual well visit appointment. No excuses. Let's get those appointments booked. This year, we are starting with preventive cares. They say health is wealth, but most of us wait until we break something before we try to fix it. But what if I told you that the most important doctor visit you will ever have is the one you make when you feel perfectly fine? Today, I'm diving into preventive care. What is preventive care? Why is it a lifesaver? And the exact checklist you need for your next appointment when you meet with your provider. Preventive care isn't about an illness you already have. It is a goal to block or delay of a development of disease before it starts. It's your body's best defense system. Well, preventive care includes things like annual well visit and physical exams, vital health screenings and vaccination, mental health check-ins and assessments, risks. Yeah, preventive care includes things like annual well visits and physical exams, vital health screenings and vaccination, such as blood pressure, heart rate, and stuff like that. Cancer, diabetics, bone health, vision and hearing, mental health checks in, and risk factor assessments. Meaning that if you visit your doctor, it's going to assess your mood, your sleep, your appetite, and any stressor. And the fourth one is the lifestyle counseling to keep you on the right track. So, why is preventive care important? Because many of us biggest threat to our life are silent killers. Take high cholesterol, for example. Bad cholesterol often has zero symptoms, but inside our body, it is causing a plaque building. This plaque building is narrowing our arteries and forces our heart to work over time. If this plaque buildup is left unchecked, it's going to lead to the following. The first one is heart attack, when blood flow is blocked by a clot. The second one is stroke, when the blood flow to the brain is interrupted. And the third one is high blood pressure, because your heart has to pump harder through those narrow pipes. And the fourth one is PAD, peripheral artery disease, which causes pain and numbness in your limbs. Think about diabetics. If you catch pre-diabetes doing a routine checkup, you can manage it and live a full life. If you wait, you risk life-altering complications like amputation, infection, immobility, disability. So, meaning you need to be on top of your game. Book your appointment, see your doctor, see what is going on with you, know your numbers, your blood pressure, your diabetics, your heart rate, all those things, establish it. It's not going to be fun when you're sick and you are trying to find out those. Definitely when you're sick, those numbers are going to be high. But your annual well visit will give you an opportunity to know your norm because you are feeling fine. So take your time to book the appointment for your well visit. When you book that appointment, let me say this, it's not just for you. If you are a mom, please do for your children or for your kids. And if you're a dad, do it for your children, do it for your wife. Do it as family or just you and your partner. Then the mom or the dad can take the children later. But my thing, my campaign is please book the annual well visit appointment for every member of your family. Remind your friends, remind your sisters, remind people that are close to you. You don't have to go and visit them at the hospital before you care for them. No. Reminding them is an act of love. Let us remind ourselves about our health. Sometimes we always think, oh, I don't want to invade their privacies. No. If you really love someone or you care about someone, kindly check with them. For 2026, ask them, have you booked your annual well visit appointments? So, when you already establish that, book the appointment, the following are the checklist lab created by me. I'm a nurse. I'm also a patient because I have my own doctor. So usually when I visit my doctor, these are the 5 labs that I usually ask my doctors to order for me so I can know what is going on in my body to stay on top of my game. So the first one, so screenshot the list which is on the screen, screenshot it, save it, share it with your friends. And what is important is important. So share with your friends and family. So the first one is CBC. Usually this check your overall health, screen for various conditions such as anemia, infection, and it also measure your red blood cells, white blood cells, and platelets. And the second lab is CMP, Comprehensive Metabolic Panel. It's a blood test for overall health as well, but for liver, kidney functions, blood sugars, and electrolytes. And the third one, which is for diabetics, HbA1c. This is usually used by the doctors or health professional to diagnose you for diabetes. So please know your number, know your norm, so you can know if you are pre-diabetics or you are diabetics or you are okay. It's not gonna hurt if you know your numbers are good. That's what you want to know so you can keep up with the good work you are doing. And the next one is lipid panel. This lipid panel check cholesterol. It is important to know your cholesterol is like head to your cardiac health. If your cholesterol is too high, it's I don't know how to put it, but trust me, it is very dangerous for your cholesterol to be high, your bad cholesterol. So lipid panel is used to check your cholesterol, and basically is to measure the fat in your blood and to assess your risk of heart disease such as stroke and plaque buildup that I mentioned earlier. And the another one that I usually ask my doctor is the TSH. This usually check the thyroid function, and this help with how your body uses energy, affecting weight, heart rate, body temperature, and digestion. Guys, you all know, I'm a nurse, so usually I've been to rehab too. I've been with I work with rehab doctors, and I'll tell you something. Usually they always check all these things to see how the patient is doing. So, and for ladies, women get for let me say okay, for ladies and women 40 years and above in Illinois, I don't know about other states. Once you are 40 years old, you are due for mammogram. Check with your doctor, and you can also check for colonoscopy, or an EKG. You can do more research too and see what you can add to this checklist to see how you're doing. Yes, how are you doing? It is very important. Preventive care is very, very important. So don't wait for symptoms to act. Invest in yourself now. Set a reminder on your phone right now to book your appointment. Not just for you, like I said, for your partner, for your children. Remind your mom, remind your dad, your uncles, Remind them. It's a kind gesture to see how someone is doing. And if you are not familiar with annual well visit, what I'm trying to say, or what that means is, you're gonna book an appointment with your doctor. They do all those labs that I listed, just for them to check how is your heart doing, how is your kidney doing, do you have enough blood. Sometimes lack of enough blood is not good. It's not good for us. So that is what I'm trying to say. So remember, health is easier to maintain than to repair. If you found this video helpful, hit the like button, subscribe for more health tips, share this video. Your health is your greatest wealth. Your health is your greatest wealth. See you in the next video. Thanks for watching. Bye.